Hi. I'm Haley. I'm a UTEP nursing student. I'm going to be performing a head-to-toe assessment on you today. Is that okay?
Yes, it's fine.
Okay, and then what brings you in today?
Just a checkup.
A checkup? Perfect. Before we get started, can I see your bracelet?
Yes.
Can you state your name for me?
Madison Gibson,
And your date of birth?
March 2nd, 1999.
Okay, and do you know where you are?
Yes, Shadow Health Hospital.
And you know what time it is?
Oof. 5 o'clock.
5? Okay, perfect. And then before we get started, do you have anything you want to discuss about your health?
No, not really.
No? Okay. Do you have any allergies?
Yes, I'm allergic to Augmentin.
Okay, what happens?
I get a rash all over my body.
And then what do you use to treat it?
I haven't had it since I was a baby, so I just never took it again.
Okay. And then do you have any food allergies?
No.
Latex allergies?
No.
Okay. Do you have any religious beliefs you want me to be aware of before we start?
No.
No? And then what's your ethnicity?
I'm black.
You're black? Okay. And then what's your current occupation? Are you a student? Do you have a job?
I'm a student.
You're a student right now? Okay. Perfect. Before we get started with our assessment today, do you have an advance directive?
Yes.
Okay, and then I do have to let you know that everything that happens here and you tell me is confidential. However, if we go into the more touchy subjects such as abuse and you let me know something by law, I do have to report it, okay?
Okay.
Right, so first we're going to go ahead and take your vital signs. You can go ahead, stand up and onto the scale. We're going to get your height and weight.
Okay.
All right, 130. You can put your head all the way back. And you are 5'6".
Okay.
All right. How are your eating habits?
They're good. 3 meals a day, even healthy food.
You drink water throughout the day?
Yes.
Is there anything that you want to change about your body? Or are you happy with where you're at?
I'm happy.
You're happy? Okay. So first we're going to go ahead and take your pulse.
Okay.
I can go ahead and see your left arm. Alright. I'm going to take it for a full minute.
Okay.
Your pulse is a little low. It's in the 50s. Is that normal for you?
Yes, I'm a runner.
You're okay. You had me scared for a little bit. The next, I'm just going to go ahead and take your temperature.
Okay.
All right, 98.6. Perfect, within range. Next, I'm going to go ahead and take your blood pressure.
Okay.
And sit back. First, I'm going to go ahead and take a baseline for you, okay? Not too tight. Okay. Like I said, this one is just going to be the base, and then we'll take your actual blood pressure right now.
Okay.
Okay, perfect. I'm going to let you rest for about 1 to 2 minutes, and we'll do it, okay?
Okay.
Alright, now that it's been the 2 minutes, we're going to go ahead and take your blood pressure. Make it a little bit tighter. Okay. Just relax your arm, keep it level at your heart. Okay, perfect. It is 120/80, which is normal.
Okay.
The last and final thing that we're going to do is I'm just going to go ahead and check your O2 sweat.
Okay.
Thank you. Just going to go ahead and put this on your finger. Can you uncross your legs for me?
Yes.
Okay, just relax it. Perfect. It's 97. Totally normal.
Thank you.
So the next thing we're going to do is a hair, skin, and nails assessment. I'm just going to go ahead and be inspecting, looking for anything abnormal. But before we get started, I'm going to ask you a few questions, okay?
Okay.
Do you have a family history of skin cancer?
No.
Do you have a history of skin cancer?
No.
No? Okay. And then do you like to do activities out in the sun, like tanning or using tanning beds? Anything
No.
like that?
Mm-mm.
No? And then when you are outside, do you use sunscreen?
Yes.
Okay, perfect. So I'm just going to go ahead and inspect your arms, okay? Check the temperature. Alright. Everything looks good. Have you noticed anything abnormal? Any new moles? Any new growths, lesions?
No, I haven't noticed anything.
Okay, perfect. You can go ahead and lay back for me. I'm going to check for swelling in the lower extremities, okay?
Okay.
Is it okay if I lift your front leg?
Yes.
Alright, and then the same thing for your legs. Have you noticed anything abnormal?
Mm-mm.
No. Alright, everything looks good. Alright, if you want to sit back up, the next thing I'm going to check your skin triggers. I am going to be pinching part of your skin, okay?
Okay.
Alright, all looks good. And the next test I'm going to do is just check your capillary refill. So I'm going to be pinching each nail for about 3 seconds.
Okay.
Perfect. Okay. Alright, so the next test, we're going to do the window test. I'm going to have you put your nails together and I should be able to see through them, okay?
Okay.
Perfect. Okay, the next one. And then your thumbs. Okay, perfect. Okay, the next test, I'm going to just go ahead and inspect your head and your hair, make sure everything looks normal.
Okay.
Do you have any concerns that you wanted to talk about while we're here?
Mm-mm.
No.
Nothing new.
Okay. Have you felt any lesions or bump when you're touching your head?
Mm-mm.
No. Okay, everything looks normal. Thank you. Also, I'm going to be assessing your cranial nerve. So this is going to be a series of tests. The first one, I'm going to be checking your sense of smell. So
Okay.
I'm going to be holding a familiar object under your nose when your eyes are closed, and you're going to tell me what it is, okay?
Okay.
Okay, if you can go ahead and close your eyes for me. Alright, what is this?
Alcohol?
Yes, an alcohol swab, perfect. The next cranial nerve, I'm going to be checking your visual acuity and your peripheral vision.
Okay.
So if you can go ahead and stand up for me.
Mm-hmm.
So we have the Snellen chart. I'm going to have you cover one of your eyes and read off the lines for me.
Okay.
Just make sure you're 20 feet. Perfect. Alright, if you can go ahead and read line number 1.
T-U-S-V.
Line number 2.
Q-R-A-C.
The next one.
K-L-T-O.
Perfect. If you can cover your other eye.
Mm-hmm.
Okay, read the first line for me.
M-A-Q-R.
Mm-hmm.
B-C-H-A.
The next one.
I-L-T-O.
Perfect. You do have 20/20 vision.
Okay.
The next test is going to be checking your peripheral vision. So I'm
Okay.
going to have you facing forward.
Mm-hmm.
I'm going to be standing behind you with my pen light. I'm going to reach it off to the sides, and you're going to let me know when you can see it in each side, okay?
Okay.
Alright.
I can see it.
Perfect.
I can see it.
Perfect. Now if you can go ahead and have a seat for me. The next test is me checking cranial nerve number 3, 4, and 6. I'm going to be looking at your cardinal fields of gaze, which is pretty much your eye movement.
Mm-hmm.
So I'm going to just have you, you're going to look and follow the pen light for me, okay?
Okay.
Okay, perfect. There's no jaggedy movements.
Thank
And have you had any problems with your vision? I forgot to ask you.
No.
Everything's been good?
Mm-hmm.
Okay, thank you so much. Okay, so the next cranial nerve I'm going to be testing is cranial number 5, and it is going to be 3 different tests, okay?
Okay.
So for this first one, I'm going to go ahead and have this object. I'm going to try to touch the center of your eye, okay? Don't freak out, it won't hurt. Perfect. Good. I was just checking your blink reflex and everything's intact.
Okay.
The next one, I'm going to go ahead and have something soft and something sharp. I'm going to be touching different places of your face, and you're going to tell me which object's sharp and which one's soft.
Okay.
Before we get started, I'll let you see what it feels like first, okay?
Okay.
So this is going to be the sharp object,
Mm-hmm.
and then this one is going to be the soft one.
Okay.
Okay, if you can go ahead and close your eyes for me.
Mm-hmm.
What's this one?
Sharp. Soft. Soft. Sharp. Soft. Sharp.
Perfect. Everything seems to be intact.
Mhm.
And this last test I'm going to be doing, I'm just going to be feeling your jaw, okay?
Okay.
Alright, if you can go ahead and clench for me. Perfect. If you can go ahead and open and close your jaw. Have you always had that popping sound?
Yes.
Yes. Does it hurt? Any pain with it?
No.
No. And then if you can go ahead and try to move your jaw forward for me. And no pain with that?
Mm-mm.
Okay. The next one, I'm going to be go ahead and checking cranial nerve number 7, which is your facial.
Okay.
First, I'm going to have you close your eyes. I'm going to give you something soft and something bitter, and I need you to tell me which one's which, okay?
Okay.
Go ahead and close your eyes for me. Alright, put out your hand. Alright, you'll tell me which one that one is.
Bitter.
Bitter, perfect. And if you can hold out your hand. This one?
Salty.
Perfect. The next thing, I just need you to smile for me. Frown.
Wait.
Perfect. Everything looks symmetrical.
Okay.
And then the last one I'm going to check is cranial nerve number 8, which is your hearing.
Okay.
Okay, so you can stand up for me.
Mhm.
So what I'm going to be doing is standing behind you,
Oh.
and you're going to be covering one of your ears, and you should be, I'm going to whisper something to you and just repeat what I say, okay?
Okay.
You can stand forward, cover that ear for me. Alright, your clothes are blue.
My clothes are blue.
Perfect. I like your headband.
You like my, I like my headband. Wait, you like your headband?
Perfect. Everything's intact. Okay, so next I'm going to go ahead and be assessing cranial nerve number 9 and 10 together,
Mhm.
which is just your swallowing reflex, if you're able to gag, if everything's intact.
Okay.
So first I'm going to go ahead and have you take a sip of this.
Mhm.
Is there any discomfort when you swallowed?
No.
Any pain?
No.
Okay, perfect. Alright, I'm going to be checking your gag reflex. If you can go ahead and open your mouth for me. Perfect. Alright, if you can go ahead and stick out your tongue. If you can say ah for me. Okay, perfect. Okay, next I'm going to be going ahead and assessing cranial nerve number 11, which is your neck and your muscles in that region, okay?
Okay.
You can go ahead and shrug up and down.
Mhm.
Any pain?
No.
Any discomfort?
Mm-mm.
If you can go ahead and do that against resistance. One more time. Okay, next, if you can go ahead and look this way.
Mhm.
And then the other way.
Mhm.
You can look up for me, down for me. And now we're going to do the same thing just against resistance, okay?
Okay.
And look this way,
Mhm.
this way,
Mhm.
up and down. No pain, no discomfort?
No.
Okay, perfect. Alright, so the last cranial nerve we're going to be assessing today is cranial nerve number 12, which is just your mouth movements, your ability to move your tongue. Before we get started, have you had any difficulty or pain in your mouth?
No.
No? And then do you practice good dental hygiene?
Yes.
Do you have a dentist that you visit regularly?
Mhm.
Okay, so the first test, I'm just going to have you stick out your tongue. Alright, if you can go ahead and raise it up for me. Perfect. Now I'm going to go ahead and just put my hand on the side of your cheek. I want you to push your tongue against your cheek, okay?
Okay.
Good. Good. Now if you can just say the words light, tight, dynamite for me.
Light, tight, dynamite.
One more time.
Light, tight, dynamite.
Perfect. Thank you. Okay, so for the next assessment that I'm going to be doing on my patient is I'm going to be assessing for the 8 lymph nodes in the head and neck region. So the first one I'm going to be checking is the occipital, the postauricular, the preauricular, the tonsillar, the anterior cervical, the posterior cervical, the supraclavicular, the submandibular, and the segmental lymph nodes. So now that I've named all the lymph nodes, I'm just going to go ahead and palpate all 9 of them on you, okay?
Mhm.
Alright, did you feel any tenderness when I was palpating or touching them?
No.
Any pain?
Mm-mm.
Discomfort?
Mm-mm.
Okay, next I'm going to be going ahead and palpating your temporal arteries, okay?
Okay.
Alright, everything seems good. The next test, I'm going to be checking you for a jugular vein distension. So I'm going to have you lay down at a 45-degree angle, okay?
Okay.
Alright, if you can go ahead, lay down for me
Mhm.
and look to the side. Alright, everything seems good. If you want to sit up for me.
Mm-hmm.
The last test I'm going to be doing is just checking your trachea, okay?
Okay.
Any pain, any discomfort?
Mm-mm.
Alright, everything looks good. Alright, so the next thing we're going to be assessing is your eyes, ears, and nose.
Mm-hmm.
For your eyes, have you had any blurred vision recently? Any
No.
vision changes?
No.
No? Okay. Have you had any discharge, pain, swelling?
No.
None of those? Okay, can you go ahead and lower your lower eyelid for me?
Mm-hmm.
Perfect. The next one. Alright, everything seems good. Can you go ahead and look at that picture frame for me?
Mm-hmm.
And back at me. One more time. Okay, this next test, I just need you to follow the pen light, okay?
Okay.
Perfect. Next, I'm just gonna go ahead and check your pupils.
Mm-hmm.
Just stay looking straight at me, okay? Good. Good. Do you have any vision changes at night?
No.
What about when you're studying? Does your vision get a little bit blurry?
No.
Eye strain?
Mm-mm.
Do you use any eye drops or anything like that?
No.
No? Okay, next I'm just going to go ahead and palpate your nose, make sure that there's no tenderness, and I'm going to go ahead and palpate your sinuses as well, okay?
Okay.
Any tenderness?
No.
What about here?
No.
Here?
No.
Alright. Just going to palpate your nose now. I notice you have a nose ring. When did you get that?
About a year ago.
Did it heal correctly?
Yes.
Any infections?
No.
Pain?
No.
Discharge?
No.
No. Okay, I'm just gonna look at the inside of your nose now, okay?
Mm-hmm.
Alright, everything seems good. Next, I'm gonna go ahead and do some hearing tests on you just to make sure everything's working properly.
Okay.
So the first one, I'm gonna do the rhyme test.
Mm-hmm.
I'm gonna have the tuning fork in front of your ear and behind it, and let me know when you can't hear it anymore, okay?
Okay. Can't hear.
Okay.
Can't hear.
I'm gonna do the other ear now.
Mm-hmm. Can't hear. Can't hear.
Good. The test was everything went good. The air conduction was longer than the bone conduction.
Yep.
The next I'm gonna do the Weber's test.
Mm-hmm.
So I'm just gonna hold the tuning fork on top of your head, and you're gonna tell me if you can hear it equally in both ears.
Okay. I can hear equally.
Okay, perfect. That's all. Do you have any questions?
No.
Perfect. The next assessment we're going to be doing, I'm just going to be looking at your respiratory system, listening to your lung sounds, making sure everything sounds normal.
Okay.
Before we get started, do you have a history of COPD,
No.
asthma,
No.
bronchitis?
No.
Does anyone in your family?
No.
Okay, so I'm just going to go ahead and just inspect. Alright, everything looks symmetrical. Have you noticed any new masses,
No.
lesions,
No.
new growths?
No.
Okay, so I'm just going to go ahead and palpate.
Mm-hmm.
I'm going to go ahead and check your AP ratio. Alright, it's normal. It's a 1 to 2.
Mm-hmm.
Alright, so I'm going to go ahead and check your chest expansion. If you can go ahead and look that way for me.
Mm-hmm.
You're going to feel my hands on your back, okay?
Okay.
Take deep breath in. Out. In. Out. Perfect. Okay, I'm going to go ahead and listen to your lung sounds now. Every time that you see my, feel my stethoscope, go ahead and take a deep breath in for me.
Mm-hmm.
Just gonna go ahead and clean it off really quick. Alright, if you can face this way. Deep breath in. Alright, everything sounds bronchial. Everything sounds bronchovesicular. Perfect. Everything sounds vesicular. If you can go ahead and face the wall for me. Take a deep breath in. Out. In. Out. In. In. Last one. Okay, perfect. Everything sounded normal, no adventitious sounds. Do you have any questions for me? Anything you wanted to discuss?
No.
Okay, and the last questions I had for you, do you have any difficulty breathing?
No.
Do you ever experience wheezing?
No.
Difficulty breathing when you go from laying down to getting up?
No.
No? Okay, everything sounds good. Thank you.
Thank you.
So for this next assessment, I'm going to be going ahead and listening to your heart. Make sure everything sounds normal, okay?
Okay.
Before we get started, I'm going to ask you a few questions. Do you have any chest pain?
No.
Difficulty breathing?
No.
Difficulty breathing when you're laying down?
No.
Have you been coughing, having a productive cough or anything?
No.
No? Okay. So first I'm going to go ahead and palpate your carotid artery, okay?
Okay.
Perfect. It's normal, +2.
Mhm.
Alright, it's normal, +2. So next, I'm going to be palpating the apical pulse as well. I am going to have to lift up your breast. Is that okay with you?
That's fine.
Okay, perfect. If you can turn towards the front.
Mhm.
Next, I'm just going to go over all the sites, okay?
Okay.
So this is the aortic,
Mhm.
pulmonic,
Mhm.
the herbs,
Mhm.
the tricuspid,
Mhm.
and the mitral.
Mhm.
Alright, now I'm going to go ahead and listen to them, okay?
Okay.
I am going to have to go under your shirt. Is that okay?
Yes.
I'm going to go down here for your herbs. Alright, everything sounded normal, no adventitious sounds, just the S1, S2.
Yes.
Alright, so next I'm going to be assessing my patient's peripheral vascular system, and really the only things you're looking for here is edema in the upper or lower extremities. I'm also going to be assessing all 10 pulse sites. Okay, so first, can I go ahead and see your arm? Have you noticed any swelling,
Mm-mm.
bruising, color changes?
No.
No? Alright. Your temp feels good. I can go ahead and have you lay down. I'm going to check your lower extremities now.
Okay.
I'm going to lift up your pant leg. Is that okay with you?
Yes.
Alright. Okay, no swelling on your lower either?
Mm-mm.
Okay. Do you ever experience numbness, tingling?
No.
No, nothing like that? What about after a race? You mentioned you were a runner?
No. No pain or anything like that.
Okay. No tenderness?
Mm-mm.
Okay, if you can sit back up. I'm going to go over all the 10 pulse sites now, okay?
Okay.
So first it's the temporal. Right, good. Your carotid. Good. Can I see your arm? Your brachial. Good. Radial. Ulnar. Right, I'm going to be checking your apical again. I am going to have to lift up your breast. Is that okay?
Yes.
Okay, perfect. Next is going to be the femoral.
Mhm.
It is your inner thigh, okay? Are you okay with that?
Yes.
Yes. Perfect. If you can lay back for me, bend this leg. Let me check your popliteal. Good. Your tibial, which is on your ankle. And then the top of your foot, which is your pedis dorsalis. Alright, perfect. Alright, for this assessment, it's going to be over the abdominal. And before you get started with this, you always make sure that your patient feels comfortable and that you provide patient privacy. And my patient here did agree to be in a sports bra during this assessment. Okay, so next I'm going to be going over your abdominal, listening to bowel sounds, just making sure everything sounds and looks normal, okay?
Okay.
So first, I'm just going to go ahead and inspect. Have you noticed any new lesions, masses,
No.
bruising,
Mm-mm.
any moles, any growths?
Mm-mm.
Do you have a change to your diet recently?
No.
No? Any constipation?
No.
Diarrhea?
No.
Any trapped gas or air? No? Cramps? Anything like that?
Just when I'm on my period.
Okay, you can go ahead and lay down for me.
Mm-hmm.
Okay, so first I'm going to be auscultating, listening to the vowel sounds in each quadrant.
Okay.
And then after I'm going to be doing palpation, light, and deep, okay?
Okay.
Right. Alright, to get your lower quadrant, I am going to have to move your pants a little. Is that okay with you?
Yes.
Okay. Alright, perfect. Everything sounds normal.
Okay.
Okay, next I'm going to go ahead and do light palpation. At any point it hurts or you feel tenderness, just let me know and I'll go ahead and stop, okay?
Okay.
And before I get started, have you had any discomfort or tenderness anywhere? Any area I should know about?
No.
No? Okay. How does that feel?
Good. Good.
Is that okay?
Yes. Yeah, I'm good.
Okay. Okay. I'm going to move into a little bit moderate palpation.
Mhm.
Same thing. Let me know any tenderness.
No, I'm good. I'm good. I'm good. I'm good.
Alright, so now I'm going to move into deep palpation. Same thing, okay?
Mm-hmm. No pain. No pain. No pain. No pain.
The next test, I'm going to check for rebound tenderness. So I just need you to tell me if it hurts more when I press in or when I release or not at all.
Okay. Nothing.
Nothing?
Nothing. Nothing. Nothing.
Alright, the last test I'm going to do is I'm going to have you turn to your side. I'm going to check kidney tenderness, okay?
Okay.
Alright, tell me if it hurts.
Okay. No.
No?
No.
No? Okay, perfect. Any questions?
No.
Okay, so for the next assessment, we're going to do the musculoskeletal system. So this is just your range of motion, your joints, make sure everything's functioning properly.
Mm-hmm.
So if you can go ahead and stand up for me.
Mm-hmm.
I'm going to check your shoulders first. If you can go ahead and shrug.
Mm-hmm.
One more time. Perfect. Okay, so now if you can go out, up, and back.
Mm-hmm.
Perfect. And then now you're going to come forward, back, and then to the back right here.
Mm-hmm.
Perfect. Did you have any pain doing that?
No.
No? Okay. The next thing, I'm just going to go ahead and look at your neck. If you can turn this way.
Mm-hmm.
The other way. Good. One more time. Okay. Good. And then the next thing we're going to check is your elbows.
Okay.
Go ahead and put your hands out like this
Mm-hmm.
and in.
Mm-hmm.
Now I want you to reach out and do that against resistance when I
Okay.
pull you. So pull towards yourself.
Oh.
Good. The same thing.
Mm-hmm.
Pull towards yourself.
Mm-hmm.
Good. Okay, now you're gonna flip your hands this way. Down. Up. This side. And back up.
Mm-hmm.
Good. So now I'm gonna test your finger strength. If you'll flip your hands over.
Okay.
And put your fingers towards yourself.
Okay.
Good. Good. And then I'm just gonna palpate your elbow, make sure. And then it can bend easily, no pain.
Mm-mm.
Alright. Good, bend. No pain?
No.
Okay. And I'm just gonna go ahead and palpate your wrists and your finger bones. Is there any pain when I do this?
No.
Do you have a job where you're using your hands a lot or typing?
No.
No? Okay. Do you ever notice swelling of your hands?
No.
Discoloration, anything like that?
Mm-mm.
In all your joints, do you have pain or they all feel good?
Everything's good.
Okay, thank you. I'm assessing your musculoskeletal, but it's just going to be the lower extremities now.
Okay.
Before we get started, do you have anything I should know about? Any pain, any discomfort?
Mm.
No? Okay, you can go ahead and lay down for me.
Okay.
So the first thing I'm going to do is I'm going to palpate the side of your hips, okay? Are you okay with that?
Yes.
Alright. No tenderness? This doesn't hurt? I'll do the other side. Okay. So the first test I'm going to have you do is I'm going to grab your foot. If we can go out. Good. Back in. Now we're going to go up. Down. You're going to bend your knee for this one. You're going to go in. Out. And then back in. Good. No pain or discomfort. We're going to do the same exact thing with the next leg. So if you can go ahead and lift up. Out. Back in. Down. Okay, bend your leg. Go inner. Out. Back in. Down. Same thing, no discomfort, no pain, anything like that. Okay, I'm gonna just feel down here, palpate. You have any problems with your feet, ankles, anything hurts? Okay, feeling all the bones. Everything seems good on this side. You mentioned you're a runner. Do you have any problems?
No, not lately.
Feeling all the bones. Okay. You can go ahead and put your ankles together. Good. Your feet, both of them together. You can go up, down. Good. Any pain when doing that? Okay, if you can get up for me, please. I'm going to have you sit in the chair and we're going to go ahead and palpate your knees.
Okay.
Do any of your knees hurt? You have any problems? Okay, now we're gonna go against resistance, okay? So go ahead and try to put your leg down. Good. We're gonna do this leg as well. Try to put it down. Good. No problems? Okay, thank you. Alright, the next thing we're gonna do, I'm gonna assess your spine. If you can go ahead and stand up for me. Before we get started, have you had any back surgeries, back pain, anything like that?
No.
No? Okay, so I'm gonna go ahead and get behind you.
Okay.
Just check your spinal processes. Can you go ahead and look down for me? Good. Just gonna palpate them. Okay, good. If you can go ahead and touch your toes for me. Alright, and you do have the C concave, which is good. If you can go ahead, stand back up. Shoulders back. Alright, everything looks symmetrical. Perfect. Okay, the next I'm going to go ahead and check your range of motions in your hips. So you can go ahead and put your hands on your hips for me. Without moving your hips, I need you to turn to the side like this.
Okay.
Good. Perfect. Was there any pain or discomfort?
No.
Right. Okay, so for the last test we're going to do is we're going to assess the patient's gait. Just make sure that she's balanced and her equilibrium is intact and there's no problems with that. So if you can go ahead and stand up for me. So the first test I'm going to have you do is you're going to be on your tippy toes and you're just going to go toe to toe.
Okay.
In a straight line. Good. Alright, you can stop. You can come back for me. Now this time you're going to be on your heels.
Okay.
And walking. Alright, good. If you can come back. The last one is we're going to go toe to heel and walking. Perfect. If you can come back for me. If you can just hold your arms out side by side. Just want to make sure everything looks good. Everything's symmetrical. Alright, you're all good. Thank you. The last and final test we're going to be doing today is going to be checking your equilibrium with the Romberg's test. Will you go ahead and stand up for me? Alright, so all you have to do is close your eyes and try to keep balance.
Okay.
Alright, perfect. Everything seems intact. If you can go ahead and have a seat for me. Do you ever have ringing in your ears?
No.
Dizziness?
No.
Nothing like that? Okay. Any medications that can make you feel lightheaded, dizzy?
No.
No? Okay. So we are done with the full head to toe assessment. Thank you for being so awesome, patient with me. Do you have any questions?
No, that's it.
That's it? You have no questions over any parts of your body?
No.
Okay, thank you.
Thank you.